Now, most college age population kids that catch COVID-19 usually are not real sick with it. Okay. They are not sick enough to have to be in the hospital and not sick enough to have to be put on a respirator or anything like that. Most of them are, sometimes they are kind of sick. They may have a fever and headache and body aches, maybe fatigue and tiredness, and may be sick for a few days, but most of them are not real sick. But they still are contagious. And so the idea was to try to take people that are positive for COVID-19 and move them to a facility that would be able to kind of isolate those sick people and be able to provide care for them there as much as we could, but not have them out going to class and exposing other people. Now, whether or not that was a good thing or not, man, I don't know. I know it's a nightmare when a person gets diagnosed with COVID-19 and has to move to Guenther. It's just not, hate to say it, but it's not the most pleasant experience to have to move to Guenther. But we had to figure out something that might help people. Now, I would say that if people, I hate to say this, but don't want to move to Guenther, don't want to have to worry about it, boy, I'd strongly encourage them to get the vaccination. The truth is, this COVID-19 pandemic has been something that the world has never seen, at least in our age. I guess back in the Middle Ages they had the big pandemics, but we haven't seen anything like that, and so it's been just an overwhelming kind of challenge for us, and the healthcare just really wasn't quite ready for it. We didn't know anything about it. I work here. I told you I work here at WT, but I also have done emergency room work, and I've done that for, gosh, about 37 years now. And we just flat out weren't quite ready for it. We didn't know how to treat COVID-19. What was the best way to treat it? It's a virus, and it's very difficult to treat viruses. Usually, it's our own immune system that